Hello everybody, and welcome, and thank you for choosing to join me for another wonderful Nurse Monday. This is a weekly show I do where I try to bring value from a registered nurse's perspective. I just want to bring a thought to the table. Let's talk about it. Let's bring it to the surface, and let's try to make things better. If you have any comments, please leave them below. Please share this video, and if you want to talk about something off the table, send me a message. I'm here to talk. Anyway, like I said, I'm a registered nurse by profession, and I do this show each week just to bring a little bit of value. Tonight we were supposed to have a guest, Kevin Jameson from the Dementia Society of America, and unfortunately we had to reschedule. But don't turn away now. I got a good Nurse Monday for you planned, and it's something that I've been talking to people over the last a couple weeks, and I just really. I want to ask you this question, and if you could leave a comment below how you would respond to it, please let me know. So, if I was a stranger, or if a stranger approached you with a cup full of medications, and they wanted to give you a cup full of, a spoonful of applesauce and meds, or maybe you didn't even know what it was, maybe you're at the point where you don't even know where it is. So what I'm trying to do is get you to be in the world of the patients that we're taking care of. If there's someone that's confused, that has dementia, that's in the nursing home, they don't always know where they're at. So as the nurse, I'm coming in, I got their medications, it's time for their meds, here we go, and they refuse them. Now let's take a step back. If you were approached by a stranger or someone that you didn't know, and you were trying to get fed food or fed something, what would your response be? Step back and really think about that situation. And this dementia care, that's what we have to do, is we have to step back to live in their reality and really see what's going on to try to resolve the situation. So a lot of times patients refuse medications, as I would hope most of you are saying. I would never take a pill or take a spoonful of substance from a stranger. The next thing I want to ask you is, say you were laying in bed and someone approached you and tried to change your diaper, change your clothes that you didn't know, or maybe they just came out there. Your first response would be to fight. For so long in my career, I've worked in nursing homes, and I've seen these things happen. Patients refusing medications, and patients fighting with the ADLs, trying to get dressed, trying to get changed, these different things. I never realized such a simple thing to do until I started doing it. And that's why I want to bring Momesto into the picture tonight is, Momesto is a tool that was designed to live in their world. I worked in this field for so long, and I never had anything or any item to resolve those situations to help me with those. A lot of times patients would refuse their medications, and yeah, I could call the family member, I could do a couple other things, but when you really have 28 patients to give meds to in a 2-hour window, you don't always have time. Now, yeah, you develop tricks and you develop different tactics as a long-term care nurse, but a lot of times you had to go back and circle the medication because they're refusing it. And I want to ask you, how many of these times do you think it's just because someone didn't know who they were? So if you had a message that said, hey, Mom, these are our friends, go ahead and take your medication, and familiarized the scenario, the situation, the patient to the person, and reintroduced yourself every time, you had a direct approach to where you were trying to come on a platform where they knew who you were, or if they didn't, you could remind them with this message, with someone that they loved. And, as a nurse, ask yourself, if you've ever taken care of someone, calling the family member and having them talk to them, a lot of times that would work to get them to take their medications. What if you had this as a tool? What if you had this as something that was easy to use? That's why I created Momesto. I needed something like that. I was in this scenario and I was stepping back and thinking, like, what would you do? What would I do if I was in this position? If someone was coming to undress you and take your clothes off, you would fight. You would try to stop them. So it's so simple. It's so simple. And it's something that we harnessed into an easy-to-use tool, a tool that was designed for this purpose, to live in the patient's world and not only implement this message therapy that I'm talking about, but music therapy also. Or, it's really simple. And I want to encourage you to leave a comment below. How would you respond if someone was trying to give you a spoonful of substance that you didn't know? How would you respond if someone was trying to undress you? Step back and think about a lot of what these patients are going through. A lot of them are trying to get out the door because they think their truck is out there and they just want to go to work. I live in the Fruit Belt, Southwest Michigan. I've taken care of countless farmers that just wanted to get out to the field and go to work. What if they could be reminded that they didn't have to go to work today, or that the work was all done, or that everything was all right, or that they were in the right place? It's so simple, and I created this tool because I was a nurse in this setting who needed it. So I encourage you to learn more, Momesto.com, and like I said, leave a comment below. If you have any other topics for Immerse Monday, please send me a message. Let's talk about it. Healthcare is a very vast thing, and I don't think enough people are just putting some of the simple questions, some of the simple thoughts out there to let's really talk about it, and let's really try to evolve how we're taking care of people and what we're doing. And if we're so lucky to have a platform like Facebook and this show to be able to talk about. So I really encourage anybody that has any thoughts, if you've ever been a patient, if you've ever been a family member, if there's anything that you'd like to add in, I really encourage you to add it in. Anyway, my name is Zach Gordon. I'm a registered nurse. This is a short one. Tune in next week where I hope to have our guest on here. And if you're interested in being a guest on this show and you could have some value to offer, please send me a message. I'm interested in hearing from other people. Anyway, I really appreciate you, and you have a wonderful day.